Stiffness after knee replacement is one of the most frustrating complications a patient can face. But here's what many patients don't realize. Stiffness doesn't just happen randomly. There are many proven factors that silently work against your efforts to increase your motion, and they can happen at any stage, throughout the recovery you're working so hard at, during the operation itself, or even before you consider surgery in the first place. Today, I'm breaking down the key factors across all three phases so that you can reduce your risk of stiffness and catch problems before they become permanent. Hi, I'm Dr. George Bounajem, Dr. B for short, and I'm a Harvard-trained, board-certified orthopedic surgeon who specializes in hip and knee replacements. We'll start with the factors that are present long before surgery even happens. These form the foundation of your new knee and your recovery. And if you understand these factors early, you're much better prepared to avoid stiffness later on. One of the most powerful predictors of stiffness after surgery is stiffness before surgery. Many people think that getting a knee replacement is like hitting a reset button for your knee. In some ways, yes, but in other critical ways, no. Getting a knee replacement gets rid of arthritis, but it doesn't always lead to normal range of motion. Here's why. The knee is a complex joint. Bone and cartilage make up an important part of it, but there are also other essential components like tendons, ligaments, and other soft tissue. When the knee's motion has been limited for years before surgery, it isn't just the arthritis anymore that contributes to the knee's stiffness. Soft tissues around the knee develop tightness in response to this limited motion. Soft tissue tightness leads to even less motion, which leads to more soft tissue tightness, and the vicious cycle continues. Now, this doesn't mean that knee replacement can't help. Many patients can and do gain motion when the bone spurs and worn-out cartilage are removed. But we can't simply cut out all the tight soft tissues around the knee because this can lead to even more problems. And since at least some of those tight tissues remain, most knee replacements can't just wipe away the tightness that has formed over years or even decades. Pre-existing stiffness is a major factor, but your surgical history can be just as crucial. Knee procedures that had nothing to do with arthritis, surgeries you might even barely remember, can silently increase your stiffness risk. For example, prior surgeries like knee arthroscopy, ACL reconstruction, or tibial osteotomy significantly increase the risk of stiffness after knee replacement. Every time you have knee surgery, scar tissue forms, but that scar tissue doesn't just disappear when you get a knee replacement. We surgeons try and remove as much as we reasonably can, but it often isn't practical or even possible to remove it all. Some of that old scar tissue remains, limiting how much the knee can move. And once knee replacement is performed, even more scar tissue stacks on top of what is already there. But scar tissue isn't the whole story. Prior surgery can even change the knee's anatomy in ways that increase the risk of stiffness after knee replacement. Overall, studies show that prior surgery increases stiffness risk by more than 70%. Surgical history is one thing you can't change, but here's another that you've carried even longer: your genetic blueprint. Some patients are predisposed to form excessive scar tissue. It's written into their biology, and this silent factor can make stiffness more likely, even with perfect surgical technique and diligent rehab. There's no widely available genetic test for this yet, partly because there isn't just one single gene that determines your tendency to scar. There are multiple genes that interact and contribute. That said, we do have some clues. If you've ever formed keloids, those raised, thick scars that grow beyond the normal wound, that may be a sign that you form more scar tissue than normal. Even conditions that affect completely different parts of the body can be clues. Pulmonary fibrosis of the lungs and Dupuytren's contractures of the hands both involve abnormal fibrous tissue formation, and they may be a sign of higher risk of stiffness after knee replacement. Now, just like prior surgeries, you can't change your genetic makeup, at least not yet. But your medical conditions? That's a different story. Health issues that seem to have nothing to do with your knee can silently work against your recovery. But unlike the factors we just covered, these are conditions that you can often improve before surgery. Diabetes is a major one. High blood sugar levels impair wound healing and increase the formation of abnormal scar tissue. If your hemoglobin A1C is elevated going into surgery, you're at higher risk not just for infection, but also for stiffness. And we aren't just talking about health conditions with blood markers. Mental health matters much more than most people realize. Anxiety and depression are common, and they can affect your pain tolerance and ability to participate in rehab. This is not like saying it's just in your head. Your brain chemistry has a direct and very real impact on how your body processes pain and heals. Multiple studies have shown that mental health problems increase the risk of poor outcomes after knee replacement. Here's the most important point about medical history. You have real influence. With help from your medical team, you can make significant improvements in not just diabetes and anxiety, but many medical problems that silently work against your outcome. Talk to your surgeon thoroughly about your medical history, and they can help you optimize what you can control. Now, once you're in the operating room, control shifts entirely to your surgical team. I'll be completely transparent here. Surgical technique absolutely plays a role in a knee replacement's range of motion. Knowing these factors helps you understand why experience and precision matter when choosing a surgeon. First, implant sizing. Most people know that knee replacement implants come in different sizes, but what many people don't know is exactly why choosing the right size matters. When we perform knee replacements, we remove the worn out bone and cartilage, and the size of what we put in, compared to the size of what we took out, plays a big role in determining range of motion. For example, if we put in an implant that is much larger than what was removed, that tends to make the soft tissues around the knee tighter, reducing the knee's motion. It sounds silly, but you can think of it like overeating. When you eat too much and your stomach feels like it could burst, it becomes really hard to bend over and tie your shoes. That same exact principle applies to the knee. Overstuff the joint, and bending becomes more difficult. But it isn't just implant size that matters. The way the implants are positioned in the knee is also critical for proper function. For example, the femoral component is typically positioned so that the groove on the front of the implant allows the patella or kneecap to slide smoothly within it. If positioned properly, the patella can slide easily, and more motion is possible. But if the femoral component is implanted in too much rotation, the groove on the front of the implant moves away from the patella. The proper tracking of the patella gets thrown off, and that can affect how much the knee can bend. Now, I'm not saying this to create distrust in your surgeon. And considering the fact that most patients are ultimately pleased with their knee replacements, it's likely that most surgeons do get these details right the vast majority of the time. Here's the bottom line. You can't control these factors directly, but understanding them helps you have an informed conversation with your surgeon about their experience and approach. These technical details matter, and surgeons who perform many knee replacements also tend to have better knee replacement outcomes. But here's the thing. Even if you have none of these pre-surgical or surgical risk factors, you can still develop severe stiffness. Why? Because what happens in the first several weeks after surgery matters just as much as what happened before and during. 3 post-operative factors can silently sabotage your recovery, and they're all deeply connected to each other. But here's the good news. These are the factors where you have some of the most control. The first one is pain. Look, for most people, knee replacement is a painful surgery. Pain isn't just common, it's expected. But here's where some people go wrong. They underestimate what they can do about it, and they think they just need to let it pass. But if your pain is so severe that it interferes with your therapy exercises, that's something to discuss with your surgical team. When pain is severe, your body responds with what is called muscle guarding. This is a reflex generated by your nervous system, and it tenses the muscles around a painful body part, limiting its movement. Guarding is a protective mechanism that normally keeps us from further damaging an injured body part. But after a surgery like knee replacement, it can be extremely damaging to progress. It creates yet another vicious cycle. Pain leads to guarding, and the lack of movement leads to stiffness. Trying to move the stiff joint creates more pain, which leads to more guarding, and the cycle continues. This is why modern knee replacement uses what we call multimodal pain management. Not just one medication, but a few different medications, as well as nerve blocks and knee injections that all work together. And a big part of this is taking the pain medications like your surgeon prescribed them, not just trying to grin and bear the pain. The goal is to keep pain controlled enough that movement is possible. But pain isn't working alone. The second factor is swelling, and it feeds directly into that same vicious cycle. When you're not moving your knee because of the pain, fluid accumulates not only around the joint, but in the entire leg. Normal movement of the leg works like a pump to push fluid from your feet back up to your heart. But the lack of movement caused by pain can lead to fluid accumulation and severely restricted motion. Think of it like trying to fold up an air mattress. It's much easier when there's no air left inside, but if there is, it becomes a frustrating ordeal, and good luck getting it back in the box. The leg works exactly the same way. Less fluid in the leg means that it can bend more easily, but more fluid physically blocks motion and leads to stiffness. Fortunately, you can influence this, and most surgeons recommend several strategies. Elevating the leg consistently after surgery helps return fluid from the leg back to the rest of the body. Pacing your activity matters too. Being on your feet too much too soon after surgery can make gravity pool fluid into your legs. Not moving enough also leads to swelling, so finding the middle ground between too much and too little activity often leads to the best results. Now, you can control pain and manage swelling perfectly, but if you're not moving your knee consistently in those first several weeks, none of it matters for stiffness. The third factor is rehabilitation itself. Like we've talked about, your body forms scar tissue during the recovery. If your knee isn't moving regularly, that scar hardens in a limited position. Consistent progressive movement of the knee is the single most critical post-op factor that actually prevents stiffness. There are 3 crucial elements to rehab: timing, intensity, and consistency. Timing means starting early. Delays in starting rehab slow down improvement in motion and function. Starting off behind sets the stage for an uphill recovery battle by allowing the inflammation, swelling, and scar tissue to get ahead of you. Studies actually show that starting exercises and doing some walking within the first day after surgery is linked to significantly faster recovery. But starting early won't mean anything if you aren't doing it with purpose. Intensity means actually pushing into some discomfort. This is the part that some patients need to hear. Gentle, comfortable movement isn't enough. Research shows that more strenuous, strength-focused therapy is more effective than gentle therapy for improving motion and function. Severe pain generally should be avoided, but not discomfort. If you only do exercises within your comfort zone, you give your body no reason to adapt and improve with time. But even perfect exercise will be useless if you only do it when you feel like it. Consistency means doing the exercises day in and day out, not just during the physical therapy visits. Patients who don't do their home exercise program are at much higher risk of stiffness and additional procedures to correct that stiffness. After all, in-person therapy is often just 1 hour, 2 or 3 times a week, and that's such a small fraction of your total recovery time. Patients need to accumulate much more time doing these exercises to urge their knee to adapt and move, and this can only happen if the exercises are done consistently at home. The first 12 weeks, and especially the first 6 weeks, are by far the most important time frame to maximize these post-op principles before the scar tissue has matured. Yes, there are many factors that can contribute to stiffness after knee replacement, and I know that hearing about all these might feel overwhelming, but here are 2 critical points to remember. First, many of these factors are modifiable. You can work on range of motion before surgery with physical therapy. You can discuss your surgeon's philosophy on pain control, and you can put in the time and effort into the rehab that your knee needs. In combination, these factors can be the difference between a disappointing surgery and a fantastic outcome. Second, even factors that you can't change, like your genetics and prior surgeries, can actually be turned to your advantage. Knowledge of these factors can arm you with even more dedication to the factors that you can control. You are that much more prepared to undergo surgery. But that preparation has to start with discussing what makes you unique as an individual with your surgeon. And that, above and beyond anything in this video, is always the best place to start. If you want to learn about 8 simple exercises that are great for preventing stiffness early in knee replacement recovery, I'll put my video on that right here. And if you want to learn about the specific range of motion numbers you need in order to get up from a chair, get into your car, and many other important activities, that video is right here. If this video helped you, clicking the like button would mean a lot. And it helps other people find this information too. Stay well, and I'll see you in the next video.